Assalamualaikum and a very good day. My name is Nur Asila binti Tajuk Arifin and I'm going to present a case study on ductal carcinoma in situ DCIS. What is DCIS? DCIS is a non-invasive form of breast cancer. The term in situ means in place, indicating that the breast cancer cells are confined to the ducts of the breast and have not spread to the surrounding breast tissue. DCIS is classified based on various factors that help determine the appropriate treatment and predict the likelihood of the recurrence or progressions to invasive cancer. So there are variation of classification of DCIS. The key classification include grade, presence of necrosis, hormone receptor status, extent and distribution of the mass, size of the mass and margin of the mass. Then the DCIS is classified into 3 grades based on how the grade looks under the microscope. The first is grade 1, which is the lowest risk of being invasive, and the cancer cell looks somewhat similar to the normal cell. Second is moderate invasiveness, and second grade is moderate invasiveness, and the cancer cell have a characteristic more abnormal than normal and grow a bit faster than low grade cells. Lastly is grade 3, which is very different from the normal cell and have a rapid growth and have a chance of being metastasized and became invasive. The cancer cells looks very different and have very rapid growth. The presence of necrosis at the center of the duct suggests high grade and higher risk of being progress and recurrence. Other than that, DCIS can also be classified based on the hormone receptor status. The hormone receptor that are tested are estrogen receptor, progesterone receptor, human epidermal growth factor receptor (HER2), and it can influence the treatment decisions, particularly with the use of hormone therapy. For this case, a 60-year-old lady is a stay-at-home mother that is presented to the SOPD with complaint of less breast lump for 2 weeks, and the lump has not increased in size, painless, and no discharge noted. The patient is having diabetes mellitus and is on insulin treatment and oral hypoglycemic agent and has an underlying dyslipidemia. She has given birth twice and had total hysterectomy, bilateral saphengo-oophorectomy (TAPSO) at the age of 45 for the case of fibroid. During a breast examination, the left breast have normal looking nipple with 3x3 size lump at the retroareolar region. The lump is high in consistency and the mammogram procedure is done, and the result shows high density mass located at the lower left mid quadrant. A mammogram procedure is done and the result shows irregular high density mass located at the left lower mid quadrant. There's a coarse group of heterogeneous calcification that suggests left breast BIRAX 5. The result of the TrueCut procedure shows microscopically the tissue shows fragment of whitish tissue, while macroscopically the tissue shows particular ductular structure that has exhibiting fenestrated proliferation and cohesive neoplastic cells, which possess mild to moderate variability in nuclear size, moderate nuclear pleomorphism, vascular nuclei with occasional prominent nucleoli and distinct cellular borders. A mastectomy specimen was sent for HPE examination. During grossing, the appearance of the skin and nipple shows that it is not retracted, and there's a raised skin lesion upon cutting the lesion, shows yellowish solid surface and has singular focality and located at the retroareolar region. Upon cutting open the lesion, it shows grayish tan solid color surface. It is adjacent to the tissue that has patchy fibrosis. In Puan H case, the patients opt for left mastectomy, although the clinician had recommended for bilateral mastectomy. Adjuvant therapy, including as hormone therapy and radiation, is used to treat DCIS with the goal of lowering the recurrence risk. After lumpectomy, radiation therapy is usually advised to target any microscopic illness that may still exist. For hormone receptor positive DCIS, hormone therapy such as tamoxifen, aromatase inhibitors is considered to further lower the chance of recurrence. The patient's age, the kind of severity and DCIS, the presence of absence of hormone receptor all influence the adjuvant therapy decisions. To sum up, the Puan H example highlights the value of early identification and customized treatment plans in the management of DCIS. Histopathologically, immunohistochemistry and imaging must be integrated for a precise diagnosis and categorization that informs the best course of treatment. The tailored approach ensures that each patient receives optimum care and based on the specific clinical pathological characteristics, ultimately aiming to improve outcomes and quality of life. These are the reference for this case. Thank you.